go on to is talking preventative skincare, something very important. And a new dermatology practice here in Nashville wants to make sure your skin is as healthy as it can be.
And we want to welcome, this is Dr. Vineet Mishra of Restoration Dermatology in Green Hills. People think that because it's fall, that maybe you don't have to worry about the sun as much, but let's clarify.
That's right. Well, first off, thank you for having me today. I really appreciate it.
Yeah.
So skin cancer is actually very common, and we diagnose over 10,000 patients with skin cancer each day here in the U.S.
Whoa, that's a big number.
Yeah,
that stops you in your tracks.
Yeah.
It is very high. In fact, we find over 4 million cases of basal cells, 2 million of squamous cells, and over 200,000 cases of melanoma per year. So it's not really season dependent, and everyone should get their skin exam if they have a spot that they're concerned about.
Well, and we have some photos to show about kind of what you're looking for, because a lot of times people do have little spots and they go, oh, well, that looks normal, or they don't even see it or notice it. So can you walk through how you know if something is more worrisome or not?
Sure. So let's talk about the ABCD rules. So this spot over here, you can see, looks like it's a dark spot. It's asymmetric. There's different colors. It's large, so we look at D for diameter. And E is evolution, so is something changing or not changing? So that's, a concern. So A, B, C, D, E, it's a rule. So once again, you can look at the photo, you can see that the spot's asymmetrical, irregular borders, different colors, larger size, or if it's changing, those are all warning signs. And if you have those, then please get it checked out by your dermatologist or by your physician.
Right, and what would be the next step, I guess, if you do have something, a spot maybe that you're concerned about? Right,
so normally what I recommend is that the patient should call their healthcare provider, schedule an appointment. If you can, take a photo with your iPhone so you can track it over time as well.
Okay.
Because this way you can see, okay, well, 6 months ago it looked like this and now it looks like this. If you have a spouse or someone who can look at your back, have them look at your back as well, because we do find a lot of spots in the legs and the back as well. So every part of the body should be checked out, and for women, the scalp as well, and men.
Oh, interesting. I was going to say, you have a few tips of how to look, for yourself.
Correct.
In the mirror. Can you kind of walk us through that?
For sure. So basically, I ask the patient, look at your arms, look at your hands. If you have like a mirror, like a handheld one, you can hold that and look at your legs and your back as well. It's important that you kind of look everywhere, because we see tumors all over, even on the feet. In fact, we do find there's certain types of skin cancers that are more prone on certain parts of the body. So just because it's not really in the sun, it doesn't matter, because it still could be a high risk for a skin cancer.
Good news, though. A lot of skin cancer is treatable.
Right.
Correct.
Right.
Correct.
Thank you.
Correct. That's the good news.
Yes.
That's the good news. So the key thing is early detection. So if you can, try to be seen as fast as you can. And if you have a spot of concern, sometimes you can even send a photo to your doctor, and they can tell you, oh, this looks benign, or this is malignant, or come back in and let's get it checked out. But you're right. Most skin cancers can be treated, and we can cut them out, and we can sew them up, and it's all done.
And before that, let's talk about how important it is to protect. So SPF daily, talk about the steps that you can take, preventative steps.
Of course. There's some easy steps that everyone can do. One is to wear sunscreen. I recommend SPF 50 or higher.
Okay.
If you can, wear a hat if you're outside. If you're a gentleman who's balding, for example, definitely wear a hat. Wear long sleeves as well. And if you can, try to prevent being outside in the peak hours of the day. If you do these small things, your risk for skin cancer drops dramatically, and patients will, do much better. And
you said titanium oxide, and there was another.
That's right. It's titanium dioxide, and zinc oxide as well.
Titanium.
And those are the physical blockers in the sunscreen. So those are safe for kids as well. And that can be found in any store, if you go to your local pharmacy and so forth. So, and this one shot glass is what you have to use to cover your entire body if you have to have an amount. So it's actually a lot of sunscreen, much more than people think.
Good.
One shot glass for your whole body?
Correct.
Oh, wow. Okay.
Yeah.
Good to know.
That's very good to
Wealth
know.
of knowledge over here. Thank you so much. Well, Restoration Dermatology is booking appointments right now. The best part, they are giving 20% off all cosmetic procedures for the rest of this month. You can check them out and book an appointment online at restorationdermatology.com. Thank you so much.
Thank you for having me.
Very important.
Thank you.